The treatment of myeloma has always involved stem cell transplantation in what we call eligible patients. What's changing is who are these eligible patients. In Europe, it is meant to mean patients below 65 or below 70 in many cases. But for the first time here now, at this ASH meeting, we have a study from Europe by the EBMT, or the European Bone Marrow Transplant Network, reporting their outcomes in patients who are above the age of 70. And they report that these patients actually tend to do very well. Similarly, we in the CIBMTR here in the US have reported similar results and published on those. So I think the most important thing is transplant eligibility is changing, and many patients who are currently considered transplant eligible should be considered eligible, because as I told you before, the standard of care of people who can receive a transplant and who are young is to receive novel agent induction followed by a transplant followed by lenalidomide maintenance. And this type of approach, there's no reason why somebody who should be excluded from that based on age alone. So that's one big change that should happen after people listen to these results. Second, obviously, is the BMT-CTN study that we talked about, where it suggests that the standard of care is transplant followed by lenalidomide maintenance, and we need to do other technologies to improve that outcome. Thirdly, we are presenting a paper on transplant in patients with renal failure and suggesting that it is quite safe, and many people come off of dialysis after receiving a stem cell transplant.